All right, let's talk about third-line follicular lymphoma. It's a crowded space, right? Well, a new paper from Danilov and colleagues is asking a really critical question. Do we have a new benchmark? Today, we're going to dig into their statistical comparison of epcoritamab, not just against standard of care, but against its direct competitors. And honestly, the results could really change how we practice.
Okay, so here's how we're going to break this down. First, we'll set the stage with the clinical challenge in third-line FL. Then, we'll get into the nitty-gritty of the study design, how they actually did this. After that, we'll dive into the results, both efficacy and safety. And finally, we'll wrap it all up with the clinical bottom line, what this actually means for you and your patients.
You know this patient. We've all seen them. They've got follicular lymphoma, they've progressed through 2 lines of therapy. The disease is just getting tougher, and our options are starting to feel a little thin. This is the exact clinical scenario, the exact challenge that Danilov's team is digging into here.
So when we're in the third-line setting for follicular lymphoma, what are we really looking for? It's pretty straightforward, but man, is it tough. We need a therapy that gives us deep, durable responses. But it also has to be something a heavily pretreated patient can actually tolerate. This is precisely the gap that these newer agents, like the bispecific antibodies, are trying to fill.
So this paper gives us a whole new way to look at the subcutaneous bispecific epcoritamab. Now, we don't have those big head-to-head trials we all wish for, right? So the authors got clever. They used a pretty powerful statistical method called an MAIC, a matching-adjusted indirect comparison, to basically simulate those comparisons. They're putting epcoritamab up against standard chemoimmunotherapy and its direct competitors.
Okay, so how in the world do you compare drugs that weren't even in the same trial? Let's take a minute to really break down the methodology here, because, understanding the how is absolutely crucial if we're going to trust the what.
Right, so this is not your standard randomized controlled trial. It's a matching-adjusted indirect comparison, or a MAIC. And the way it works is actually pretty smart. It takes the individual patient data from the epcoritamab trial and then statistically re-weights that data until the patient population perfectly matches the population from another study. What do you get? Well, you get a balanced apples-to-apples comparison. It's really the next best thing to an actual head-to-head trial.
So using this method, the authors set up 3 key matchups. They took epcoritamab, using the data from the EPCORE NHL-1 trial, and first, they compared it against standard of care chemoimmunotherapy from the SCHOLAR-5 study. Then, they put it up against 2 other bispecifics, mosunetuzumab using data from its trial, GO29781, and finally, odronextamab from the ELM2 study.
All right, first things first. Let's look at the data against the established standard of care. How does this novel agent really stack up against the chemoimmunotherapy regimens that we're all so used to using in this setting?
And, wow, the results here are pretty dramatic. Once they matched the patient populations, the overall response rate for epcoritamab was nearly 91%. I mean, that is a huge leap from the 57% they saw with standard of care. And as you can see, that difference is highly statistically significant.
Okay, but what about complete response? That's what we're all really aiming for, right? Well, the data here is even more striking. The CR rate for epcoritamab was more than double that of standard chemoimmunotherapy. We're talking almost 74% versus 32%. Again, a hugely significant finding. To really put that in clinical terms, the analysis found an odds ratio of nearly 6. What does that mean? It means a patient on epcoritamab was about 6 times more likely to get into a complete response compared to someone getting standard chemoimmunotherapy. That's a massive difference.
And these incredible response rates, they weren't just for show. They translated directly into a really powerful survival benefit. The hazard ratio for progression-free survival came in at 0.321. In plain English, that's a 68% reduction in the risk of the disease progressing or death for patients who got epcoritamab. Just let that sink in for a second.
Okay, so it's pretty clear epcoritamab blows standard of care out of the water. But for many of us, the real question is, how does it stack up against its direct peers? Let's get into the bispecific versus bispecific comparison.
So here's the breakdown. When they compared it to mosunetuzumab, epcoritamab had a numerically higher overall response rate, about 91% versus 80%. That difference got close but didn't quite hit statistical significance. Now, against odronextamab, the ORR was significantly higher for epcoritamab, and when you look at complete response rates, they were numerically better than mosunetuzumab and looked pretty comparable to odronextamab, with no statistically significant differences there.
Look, efficacy is only half the story with these agents. We all know that. Tolerability is really what makes or breaks them in the clinic. And with T-cell engagers, it all comes down to two big ones, right? Cytokine release syndrome, CRS, and that neurotoxicity we call ICANS.
And this is where we see a potentially major advantage for epcoritamab. Check this out. In the matched analysis, the rate of severe, grade 3 or higher CRS was 0%. That's compared to over 2% for musinduzumab and nearly 4% for odronextamab. And maybe even more impressively, there was 0 ICANS events of any grade reported for epcoritamab. That's a pretty big deal.
So why the great safety profile? The authors suggest this isn't just a fluke. It's likely tied to the specific mitigation strategies they used in the EPCORE NHL-1 trial. We're talking about things like that extra step-up dose, the dexamethasone premedication, and making sure patients were well hydrated. It seems those details really matter.
So, after digging through all this data, what's the bottom line? What are the key takeaways? How do we take this indirect comparison and actually apply it to our clinical decision-making?
I think you can really boil it down to 3 main points. First, the data makes a very strong case for superior efficacy over standard chemoimmunotherapy. No question there. Second, when you put it up against other bispecifics, it's got a really competitive efficacy profile, but with what looks like a potentially best-in-class safety profile when it comes to CRS and ICANS. And third, let's not forget the practical stuff. Being a subcutaneous injection is a real advantage in the clinic.
Now, of course, we have to be good scientists here and talk about the limitations. An MIIC is powerful, but it's not a substitute for a randomized head-to-head trial. There's always a risk of some unmeasured factor that could be skewing the results. And, we're still going to need longer-term follow-up to really see how durable these outcomes are.
So, where does this leave us? This analysis gives us some really compelling new evidence. And while it's not the final word from a randomized trial, this paper makes a very, very strong case that epcoritamab's combination of high efficacy, a really standout safety profile, and the convenience of subcutaneous delivery, well, it could represent a new benchmark in this tough setting. The big question now is whether future data will confirm its spot at the very top. Thanks so much for tuning in.